treat things one by one, okay? So one of her first issues was her hip flexor. So instead of feeling it in her right hip, she's feeling it in her back. So we're gonna show her a transverse abdominis core workout / dead bug, okay? So Casey, let's have you lie down on your back. First, the most important thing, she needs to learn how to engage her core muscle. So Casey, I'm gonna have you face that way.
Okay.
And then you're, no, with your face.
Oh,
with your
got it.
face. And you're gonna cough like that.
Okay.
So by coughing, it automatically engages your core muscle. So go ahead and relax now. Okay. Can you engage it like you were coughing without the cough? Yes, exactly. So now she's kind of pushing her stomach out. So while you're holding and maintaining that position, okay, you're going to bring this leg up into a 90-degree position.
Okay.
Okay.
Mm-hmm.
Now you're going to bring this leg up into a 90-degree position. Okay. Now you're going to bring this down. And then you're going to bring this down. Okay, don't let go. Okay?
Don't let go?
Don't let go of this.
Oh, got it.
Okay, otherwise you're going to feel it in your back.
Yeah.
Okay?
Got it.
So while she's doing that, I can already feel the instability. I can already feel her right leg shaking, and so that's completely okay. What that's indicative of is weakness, and so as she's doing this every single day, every single week, she will feel stronger, and as she feels stronger, she'll feel more stable. Sorry guys, heartburn. It's what happens when you turn 31. Okay, so Casey, we're going to have you do 15 reps of this, okay?
Okay, is it 15 like alternating?
Yeah, so it goes like...
So is it bicycles?
No.
Oh.
You're going to go like this, 1, and then go up, 2,
Okay.
and then bring this down, and then bring this down. Good. Now bring this up. There you go. Good. 4, 5. Good. Make sure to hold both of them for like a moment. Okay? And she's doing a good job where she's engaging her core the entire time. Hey guys, thanks for joining in. My name is Dr. Patrick. I'm a physical therapist in OC, California. We just went through Casey's evaluation here, who has pelvic instability. We are showing her stability exercises. First exercise she's doing is called the dead bug. Most important thing here is engaging the core muscle. By doing this, we are going to take away the compensatory back pain that she's having. What number are we on, Casey?
12.
She's on 12. Casey, how hard is this? Or easy?
It's getting harder.
It's getting harder. Surprisingly, right? Doesn't it look easy?
And I feel like a tightness in my hips.
And she feels a tightness in her hips. Okay.
But I don't feel it in my back.
Good. So it's easy to get caught up when you're at the gym. You're trying to lift like hundreds and hundreds of pounds, or maybe more like 40 or 50 pounds. But really, everyone should start at the at body weight exercises and then progress from there.
Mm-hmm.
That's my cat, by the way. Okay, so Casey, what I would tell her is she should do maybe 2 sets of 15 every other day, every 2 days. Okay. Okay, so that fixes her hip flexor issue, okay? What else did I say? She has an issue with her hip internal rotation and hip external rotation. So what can we do here? So hip external rotation, right, is the glute med. So what I'm gonna have her do is I'm gonna put a band around her knees and we're gonna have her do bridge exercises. That basically engages that glute med exercise, okay? Or glute med muscle. So give us a moment. We're going to put this around her knees, ankles, knees, and then we're going to tie this super tight.
I actually warm up with these at the gym every leg day.
She's such a beast. Okay, you're going to push down, you're going to lift up. Okay, you're going to hold there, and then you're going to open up. Sorry, stay up.
Okay.
And then open up your knees.
Yeah.
Yep, and back. Yep, just like that.
How many?
You're going to do 10. There you go. 4, 5. So, you're going to look at her hip here. She's going to try to keep this hip up. trying to basically keep this straight line here, okay? The main goal here is she should not feel any pain. If she feels pain, she should let us know, and we're going to modify her parameters. Good, and come back down. That's what you do at your gym warm-up already?
Yeah.
Okay, so then we're going to give her something else in addition to that. Ooh, actually, we'll give her some sliders.
Oh.
So Casey, I'm going to have you go onto all four position. Okay. We're going to go, do you know fire hydrants?
Yes.
Exactly. You're just going to touch my hand, right? Exactly, right there. So you can see the shaking. That's completely normal. That is something that we want. This goes into hip external rotation. Hey guys, thanks for the likes. We really appreciate it. The likes really help our business out, so please continue to send them.
How many am I doing?
We're doing 10 total.
Okay. I'm good there. Going
Okay.
around?
Yeah, we're going to do the other side. So Casey, go ahead and flip around. So hold on, wait. You're going to go neutral right here. So your goal is to not break this position.
Got it. Okay.
So go ahead, go again.
Oh,
Yeah.
it's hard.
So don't go about like 25% the height. Yeah, right there. So I basically told her to limit her range of motion. That way she compensates less. Can you kind of feel that, Casey?
Yeah, I feel it.
And it's her left side. It's going to be a single leg exercise. So Casey, I'm going to have you stand up. Okay. And then you are going to pretend like you're in a clock. And then you're just going to go like around the clock. Okay? Like from maybe 3 o'clock to 6 o'clock. There it is. If you look at her pelvis, we want her belt line to stay horizontal, and we want her belt line, or we want her vertical line from her belly button to her nose to stay as vertical as possible. We don't want her to break that position or drop that pelvis. And she's doing a wonderful job on that left side. So if you kind of remember when we were testing, her left side was pretty darn strong. We're going to see what it looks like when she goes on her right side.
Feel it in my glute.
Yes, exactly. That's what we want.
Okay.
Okay, so now we're going to go on the... Oh, did you check that out, guys?
It's actually so much harder.
It's so much harder. That's what she said.
And also I feel like, doesn't it look like this?
Yeah, and if you notice her knee, her left knee right here, it's like breaking inward, right? You want to keep that leg as straight as possible.
I'm gonna move forward a little bit.
So hold that position. Just hold it. No. Come back. Just hold that position. Okay. Push your knee into my hand. Right there.
That's where it should be?
That's where it should be. Way harder, right?
Yeah.
So this is completely okay, guys. You'll see her shaking. You'll see her kind of like breaking. That's okay, because that's the point of the exercise. As she continues to do that exercise every other day, two sets of 10 on each side, she'll start to notice that her hips start strengthening, the exercise becomes easier, and her everyday life starts becoming easier, okay? Because all range and all mobility all come together with everyday movements like walking or getting into your car, getting out of your car, going hiking, that type of thing. Okay, so Casey, we went over your hip flexion, we went over your hip internal and hip external rotation. The last thing we need to go over is her posture, her movement, okay? So one thing that we notice in her mobility is that she's hyper mobile with internal rotation on her, okay? So can you go ahead and show us a squat?
Sure.
Okay, you're gonna go ahead and just keep doing squats, okay? So right now we're just kind of looking at her alignment right now. She's shifting to the right, my right. She's shifting this way. Every time she squats down, it's like a boop, boop, that way. Okay? So what we want is we want symmetry. She goes down symmetrically on both sides. The fact that she's kind of deviating like laterally to one side shows the weakness. So we're going to correct her. We're going to show her how to fix it. And then that's going to become her exercise. That's learning the movement. Okay? So we're going to go back into that squat exercise. But this time I'm going to tell Casey, let's drop that range by about 50%. There you go. That's actually perfectly fine. So I'm going to do a little bit of a test here. We're going to check to see her alignment. We're going to put this right against her back. It's going to look like this. Like that. Okay, 3 points. Like lower back, or I mean like your bottom, your back, and then your head. Can you kind of feel that?
Yeah.
Okay. So essentially, guys, Casey, do you want to turn around for us? So I place this linear object. It could be anything. Right now I'm using a cane. It could be a Swiffer. It should have 3 points of contact, okay? It should have your lower back / bottom. It should have your mid back, and then it should have your head, okay? Right now she's making all 3 contacts. When she goes into a squat, she should be maintaining all 3 contacts, okay? So let's... There you go. So her success rate is gonna be like 40, 50, 60%, but that's okay. If she was good at this, there'd be no reason for me to give it to her. So this is gonna be something that she works on. This one, she could do it daily, and she could actually do like 50 plus reps, because technically in the world of learning, you need to do thousands of reps to really understand something. This is really, the subject line here is pelvic stability. So, hey guys, thank you for joining in. My name is Dr. Patrick. This is Casey. We're going over pelvic health and exercises. Okay, so Casey, we're gonna go back into squats now, but this time she's gonna do it facing forward. Good. And relax completely. So guys, as you can see, there's a lot of instability, a lot of shaking. So it's all about intention here, right? When people go automatically into squats, they automatically think, okay, my goal is to lift the maximum amount of weight. My goal is to perform the maximum amount of repetitions. Okay, so this intention here is different. Casey's goal is not weight, it's not reps. Her goal is movement. I want her facing a mirror when she's doing this, and literally her goal should be getting every movement 100% correct every single time. If you can do this, I'd say like for at least a few weeks and have it perfect, that's when you start loading the weight. If you try to load a weight and have instability, that's when issues happen. Okay, we're gonna go over one last exercise. Casey, you're gonna go ahead and stand on this. Okay, you're gonna stand on one leg now. Okay. Her goal is to stay as stable, as straight as possible, right? Belt line, vertical line. How she's gonna accomplish this is by squeezing her left butt and squeezing her core like no other. Hey guys, thanks for all the likes. We really appreciate it. Perfect. Okay, and then now we're gonna try her other side, her weak side. There we go. You guys can see the instability. So really squeeze that right hip.
I also feel like a tightness or maybe a pain behind my butt.
So her location is actually the glute med. That is the correct location. She's feeling a pain. What that means is her glute med does not have adequate strength in order to be doing this exercise. So we're gonna regress it. So go ahead and relax. We're gonna come off of this. Do the same exact exercise without the pad now.
On the right side?
On the right side, yes. And do you feel just as much?
I feel it in the front versus the back.
Okay, squeeze your right butt more. And then bring this leg down. Like, don't touch the ground though, just bring it back.
No.
Where do you feel it?
I actually don't feel it.
You don't feel it anywhere?
Well, I feel like a burn.
Yeah, you should be feeling it there.
Yeah.
Okay. So, relax completely. Essentially, Casey's saying like she's having issues feeling it in the right area. She's feeling it in the front of the head. That's not where you're supposed to feel it at all. She's feeling it in the side. Questionable, right? Is it the IT band or is it the glute med? So again, this exercise does show that she needs to work on this just to make sure that she's engaging the right muscle. And the reason why this is so important is because if you think about it, walking, running, they all require single leg balance. So if you have a problem with single leg balance and you have instability and say you're pregnant, there's going to be a lot of pelvic issues and back issues. So what's also cool about this pelvic exercises that I'm releasing, if you've ever had problems with incontinence, right? People kind of laugh about it, but let's kind of get over that. Like, let's say you're doing jumping jacks, let's say you're running, let's say you're doing like squats, or like you're at a concert, you're like dancing to music, and then oops, you kind of pee yourself a little bit. So it's kind of funny, but it also isn't. It's not a helpless issue. It's a pelvic floor issue. If you do pelvic floor exercises, you can reduce that type of incontinence. And so that's a program that we will be releasing very soon in the future.